Hi, I'm Mike Hisey with Texas Back Institute, and last year, or a couple years ago actually, I did an interview about Prince Fielder's injury. At that time he had a herniated disc in his cervical spine, and that was ultimately treated with an anterior cervical fusion, and he did very well with that, which is typical for these patients. Now what's gone on with him is he's gone on to develop disease at the segment just above that. And so that's giving him the similar sort of symptoms, and it may be that he requires another surgery to fix that. And so the options for him at this point include extending the fusion up one level. Potentially sometimes you can do non-surgical stuff like physical therapy or injections, but it wouldn't definitively treat it. But another option for him that he may want to consider is an artificial disc. So that's something that would preserve the motion, have a faster recovery. So these segments are the cervical spine, these 7 vertebrae in here. And when a disc herniates, it pushes backwards towards these nerves, and you can't see it because there's a lamina covering it, but that herniation would be back here and may pinch this nerve as it comes out. So when this nerve is affected, it can cause pain radiating into your arm and even cause weakness in the muscles that are powered by that nerve. So in a baseball player, obviously that would affect the strength in his arms and therefore affect potentially his strength when throwing or his strength when batting. So in a typical patient, a disc herniation can be treated with either a fusion or a disc replacement. The disc replacement has the advantages of quicker recovery, and the biggest advantage, I think, is it doesn't stop the motion at the level being treated, so that you're not putting extra stress on the one above or the one below, so that down the road there's a lower chance that that will go on to degenerate. I'm not the doctor taking care of Prince Fielder, and so I don't have all of the information about him, so all of this is very general and applies to most patients, but may not apply specifically to him.